Welcome to the Deconstructed Woman podcast, a podcast about breaking down barriers between women, exploring and sharing perspectives of each individual woman's experience, and discovering what we have in common and what makes us different. Hosted by Elisa Marie and Joji. Welcome back to the Deconstructed Woman podcast. Joji and I have had some conversations over the last couple weeks, and one of the topics that came up was about how medical terms are used for women and how they should have evolved a little bit more by now. It feels like a lot of times terms are used in a way that the medical field has to explain what's going on. It also feels like they should have maybe changed their terms or looked at them a little bit differently or tried to at least make it a little bit more palatable for people who are going through these different experiences. One of the things was the fact that after the age of 35, you're considered a geriatric pregnancy. I think that there should be some changes in Joji, and I will talk about it. But things like geriatric pregnancy, obesity, feel like they're offensive, yet they're used consistently in the medical field. And so we've looked at a couple of articles and how does this pan out for the rest of the world, and then bring it back to our own experiences as well. But I think that there's a lot to unpack here because typically these types of terms apply to women. Joji, I know that you had looked at quite a few articles and we were talking about it just before we got on. What has been your experience? Where do you see this most prevalent for you?
I didn't have a geriatric pregnancy because I had started a little bit earlier. But my experience generally feels like whenever it's in a healthcare environment, there's a lot of either body shaming or just feeling my body is not doing right by me, just because I've had a lot of chronic health issues. What is my body not doing? And then what am I failing to do? Why am I in this situation with a body that is not working like everybody else? The last 10 years, there's been a lot of talk about your DNA and your genetics. So maybe it's not really me personally as much as my family. I've always wondered, why is it that the first thing when you walk into an appointment, they weigh you right off the bat? Most women hate being weighed, regardless of what their weight is. I know many women who are quote unquote normal still hate being weighed because I think that process feels so discouraging to women. For me, it's not necessarily just because my health issues are so broad that I feel like the whole process of healthcare has just been one negative message after another. I rarely look forward to going to the doctor because some part of my body is going to once again be highlighted as failing. That's a central theme with words that are used to describe women in different times of their life. And so I agree with you. I think that it's a very unpleasant situation when you're in the healthcare environment. Is that what you meant?
Exactly. I have so many medical appointments right now. I go pretty much weekly. I didn't even think about the fact that they weigh you. I tune it out. I don't even look to see what the scale says. I know that it's going to be in this general ballpark. I know they're going to say I'm obese, and I'm okay with that. I've become desensitized to it. I think that's a great point that you bring up, that that is how you start every single appointment. It's universal. I'm talking about the medical terms specifically just because geriatric pregnancy is something that I've dealt with for the last 4 years because I had kids later in life. But I think that it's not only the terms, it's how you're approached, it's how the medical field, and not to say that they don't do great things. There's just a lot of ways in which things are handled that I think could really look differently.
I think this might be a good time to reference the article from the University of Wisconsin. It says, when it comes to pregnancy, why is the terminology so rude? And it was from July 2022, and it's by Heather Logue, Logue. The article is in their wellness magazine, Right as Rain by UW Medicine. Let's talk about some of the language that they discuss specifically around pregnancy. They say geriatric pregnancy, which is 35 years plus. They say incompetent cervix, and this just sounds like a horrible description. Habitual aborter, which is 3+ consecutive pregnancy losses before 20 weeks. Those words seem very harsh to hear. One of the things that the author goes on to say, these words are actually used in a social context in the culture of the US. And one of the things that the article refers to is the fact that in medicine, early medicine goes back to looking at the male body as their sort of archetype for studying the human processes. Male bodies were the standard, and now you've got the female body that, in so many ways, I feel is more complex and is required to do so many more advanced things like carry a child and give birth. Yet the things that are within that health condition are termed in very negative terms. They talk about the fact that it's a cultural issue and that we as women don't fit into the male body type. Therefore, there's something wrong with that. As a result of that, the language used to describe the women's body processes are seen as being irregular or wrong because it doesn't fit into a male body. Once again, the women's bodies are seen as a second class citizen. We're not a standalone entity being looked at as an individual body type, whether it's consciously or unconsciously, we're being compared to the male body because that's the standard. That sets women up for failure. What do you think about that, Alyssa?
Yeah, all of those terms that you listed off, I've heard them or had them applied to me. It's a really unfortunate circumstance because some of them I didn't even know. There wasn't a conversation with me and my doctor. But when I looked in my chart, there were terms that were used that I was like, what is this? That's not accurate. And I would call my doctor or send a message and say, hey, there's this term in here that I don't think that applies. They're like, oh, yeah, that's how we label it. Okay, but that should have come with a warning of some sort. Hey, this is going to be in your medical records that carry with you so that people are not blindsided by that. I think it was really hard to see that initially and not have a visceral reaction to it.
I just had a very similar experience where I looked at my medical chart. This is more of an issue of the fact that our medical professionals don't necessarily clue us into what they're thinking and how they're diagnosing us. And yet they document something in our medical record, which is a permanent part of our record. I was reviewing my medical record, and one of my physicians made a comment about kidney malfunction, about the fact that my kidneys weren't functioning at a high level. I didn't know that I was diagnosed with it. I didn't know what the problem was. I don't know how I fixed it because it's not there anymore. And so it dropped off my record. And so once again, it's exactly what you're saying. It's like when you look at your medical record, and now that we have access to it with all the patient portals, medical professionals have to be mindful of the fact that they need to introduce these ideas to us so that we're not looking at it for the first time when we're looking at our medical records, because then it's really scary and it can actually create a lot of anxiety that probably isn't warranted. But yet we've had no discussion about this. And I'm not saying that medical professionals should ask us permission before they put this in there, but some level of conversation around this would be helpful. So we're not seeing it for ourselves for the first time on our own when we're accessing our records. And I do know that's a really big issue that oncologists are definitely aware of. But how about all the other specialists? So it's not somebody with that fellowship or that specialty that diagnosed me as kidney malfunction, failure, whatever it said. It was a primary care physician who did that. And so then it just makes me wonder, like, oh, should I go see one? Is there a problem? What was it? And how did I fix it? And how do I not get there again? So it actually did raise my anxiety quite a bit. And then just because of how life gets so busy, you just file it away in your head. I don't know if there's a residual that happens day to day or if it's just gone and I don't think about it anymore in my subconscious. But that's an example of something that I also saw in my medical record that was really jarring to me.
Yeah, I think in general, it doesn't apply or it's not accurate. Again, these terms should have evolved by now. We should have better ways to describe things. Baffles me because I feel like, haven't we learned that women are having children later in life and going back to geriatric pregnancy? Because that's where I'm at right now in my life. Why do we not have better terms for this? Why hasn't it changed? Why hasn't it evolved? Why are we still calling these things this way? I think the article that you read spoke to that as well.
Yes. And so I can't imagine being so excited that you're pregnant, whether you've had a challenge getting pregnant or not. And then here you are coming into your OB appointment, and in a very sterile kind of way, they describe you as a geriatric pregnancy. And I do wonder, what is the process for healthcare to rename those terms? Like you pointed out, women are waiting longer. This has been something that's been going on for at least a decade. So it's not something new that women are not having their first pregnancy until 30, 35 because of education, because of their careers and things like that. How do we modernize some of this language? But I also think that with the term obese has been described to me in my shape for a long time since I was a young child and hit puberty. People around the world or in the United States are eating differently than we did. When was a medical model for the weight ranges originally created? Was that in a time where food was scarce, when there was the world wars? Can we update that a little bit? Are there different words that we can use so the description of your weight is not a judgment? Is it a collection of people who think that obese is a judgment? Is it really said in a harsh way? Is that the way we hear it? My point is we could choose a non-judgmental word and then over time that's going to feel judgmental because it still means you're overweight. The article talked about, for example, the word incompetent when it's talking about an incompetent uterus. There are other medical terms for men and women that use the descriptor incompetent for different health types, like cardiology. They use the word incompetent valve. But what the article pointed out is that it's not usually shared at a time where women feel vulnerable and their bodies are taking on more duties. So when you're pregnant, and say, for example, you've had a hard time getting pregnant, you feel grateful when somebody is describing your uterus as being incompetent, or the fact that your pregnancy is a geriatric pregnancy, almost to the point of no wonder your body isn't working. You waited until you got to this age. I had a friend of mine who was probably in her early 30s, maybe not yet 35. When she couldn't get pregnant, she ended up going to a fertility specialist, and they just kept talking about how old her eggs were. She was so upset. Yes, I wanted to wait till my career was settled and I had the money to have this child. She was choosing to have a baby on her own without a partner. And she just thought, you know what? I want to have a baby. That's my desire. I can afford this child. I want to do it. But she couldn't. All of a sudden, her body wasn't working with her. The person she's talking to, a specialist, told her that her eggs are too old and she waited too long. She was crushed by the news because I didn't feel at 25 or 21 that I could have a baby and give this baby everything I wanted to give. So now I'm being punished or made to feel bad. My heart went out to her because I could feel her sadness and her rejection of her own body and her own decisions. But at this point, it's too late. Sadly, she's never been able to have a child. We're paying people lots of money to make us feel worse about ourselves. And so I feel badly for every woman who has to go through your situation and other women I know that have been called a geriatric pregnancy. It's just such a harsh label.
It is. And I'm sitting over here, my heart's sinking for your friend because I likewise have had so many friends who have had fertility issues and things like that. You're being given this language at the most vulnerable time. I recently had to do the gestational diabetes test. They were like, well, you're obese. And so your likelihood of having this is pretty good. And I've never had it. I've had 4 pregnancies, never had it before. And they were like, but you're getting older. Just all the judgment that oozed out of the conversation. Goodness, thank you. Thanks for the reminder. This is a possibility. I know it's a possibility. I eat fairly healthy. I try to take care of myself. I think that the BMI should be changed. These terms should be changed. All the things at this point in my life. I think that's probably why I ignore all these things, is because I've just come to the point where this is not accurate. I know how I feel. I know that I can run around with my kids. I'm not winded. Like, I know that I feel good. And so I'm just going to ignore these medical terms that make me feel bad.
I think that's the lesson here is for healthcare in medicine. Women are edging out men who are going to medical school. And so I do think it's an opportunity for us women to understand it's really difficult on one hand because when you go through medical training, the language is very medically focused. And you could, I think, be an OB-GYN or a nurse who's working in the OB-GYN area, thinking that incompetent uterus is just the medical language that you use. But I think as women, we need to understand the fact that these are terms that are hurtful to us. Women are more sensitive. Women are vulnerable when they're pregnant. A lot of women have been waiting for this opportunity for a long time. And we have to really be careful about the language we use. Being pregnant was the most beautiful experience that I had. I really realized that my body was made to have babies. I had a very comfortable pregnancy. I was gestationally diabetic because of my heredity. But even in spite of that, I had never felt more beautiful, more glorious. People give you all sorts of attention when you're pregnant. I just really felt like I was Mother Earth, just beautiful, serving the purpose that my body had set out for me. And those 9 months were a tremendous time for me. And so, on one hand, it is all those things, but yet every once in a while you'd go in and you'd have this shot of negativity. You really had to actively not think about that stuff. You have to practice that. You have to hone that as a skill so that you can enjoy these times in your life. Why should we have to do that? That's why I keep harping on the medical professionals who are listening. We have to be mindful of the language we use, not only in diagnostic situations or in treatment environments, but also in other ways because we are already torn apart. I'm going to share this example I used to do with my adolescent groups. You give them a sheet of paper and have them rip out little pieces for thinking of a day and how other people in their life have made hurtful comments to them. And so part of the exercise is by the time you get to the end of their day, they don't have a lot of paper left. They've ripped out little pieces of paper for the comments that people have made to them. The last part of the exercise is saying self-affirming information, taping those pages back together so that you're at the end of the day, you try to have a full sheet of paper again. And I think metaphorically, I think that's what women go through throughout their whole life. So by the time that they get pregnant, maybe they don't have a lot of paper left. And then now they're coming into this OB appointment, which is part of their most beautiful moment in their life. They're happy, their partner is happy, families are thrilled for them. And then they have to hear all the negatives that are associated with their pregnancy. Once again, those papers get ripped. And so I just feel like women's daily process is challenging. And I'm not saying that women have the corner on that. I'm sure men and boys go through that as well. But I think that during our conversations, we always come back to the fact that women in society, women in everyday processes just have a more difficult, challenging process just purely based on their gender. We need to try to compensate for that and take care of ourselves. And like I always say, lend a hand to a woman. Be mindful of this woman who needs to have a little bit of a lift today. Be that person for her because she needs that. It just shows so well every day how much we lose of ourselves and how hard we have to work to regain that sense of self by the end of the day.
Yeah, you're making me think of some of my other experiences too. A lot of times I try to compose myself while I'm in the doctor's office. And then as soon as I leave the doctor's office, I'm crying or just feeling completely defeated. I don't want to do that in front of the doctor because they're just trying to do their job and I get it. But there's just been devastating moments where I'm going to keep it together until I get out of here. And then I'm going to express myself. I think that this is kind of that conversation being had in out in the open again. I mean, the purpose of our podcast is to deconstruct things and pull it apart. And so I think that hopefully others can relate to this conversation about medical terms. I would love to hear how other people see it too. I think that these conversations maybe are not being had with the medical professionals. Again, I know for me, I try to compose myself. I remember recently I had a doctor's appointment where they gave me a lot of really negative, really hard information. And I just sat there and took it and nodded my head and asked some basic questions. And I walked out of the office and I had run down the hallway because I was throwing up in the bathroom because I was viscerally sick from the amount of negative information that was given to me in one sitting. They were not privy to that. I wasn't having a conversation with them about this was really unnecessary and I didn't need to know all this. It's us saying, hey, there are things that impact people in a very negative way and it's happening when they're most vulnerable and that's something that we need to really look at. Again, I think that maybe if enough people raise their voice about it, maybe there will be some movement to change it. I'm surprised that in 2023 We're still talking about geriatric pregnancies at, after the age of 35, but it is what it is. I think, obesity is still a thing. All of these terms are still being used on a daily basis, but it does feel like we need to say something different. We need to call it something else, or it says this, but this is what this really means. So that's my last 2 cents. I don't know if Joji, you have anything else to kind of add, but I think that for me, it's a challenge, but at the same time, I've just turned my back on some of it and said, I'm just going to push forward and whatever happens, happens. I have to put myself in the hands of these medical professionals and hope that they know the best of what they're doing. But I think a lot of times it can be a challenge because you're kind of inundated with terms and verbiage that is just rude in any other setting.
Yeah. And my final thoughts on that is how the article ended, which was to say, as women, we need to ask for what we need. And so if you hear something that doesn't sit right with you, let them know, not in a mean way, but to say, hey, I really don't like that word used to describe what I'm going through. And can you put that in my chart, share it with the other staff? I don't want to be referenced as a geriatric pregnancy. And so I do feel that unless we use our voice to be able to ask for what we need, and you may have to repeat it several times, but that to let them know, because I can say that as somebody in the medical field, I think that those comments that our patients make to us leave a lasting impression. The older physicians are cycling out. We now have younger physicians. We can help shape them to be more sensitive to women's causes. They've been trained a certain way, and we need to humanize them as to how they have to treat people who are going through this. We have a right to be treated with respect and to be spoken to as we're human beings and with kindness and love and celebrating whatever we're going through in the best way that we can. And so I say, hold our health professionals accountable to treat us the way we deserve. That's going to make them a better practitioner. So do your part. It doesn't have to be rude. You don't have to challenge the doctor. You just have to say, hey, I really would appreciate if you didn't speak that way, or how do you think that landed with me, to help them understand that it's a very critical time in your life and that you need to be approached a certain way. So I want to thank our listeners. And I know we have medical professionals that listen to us because a lot of my friends do. And so please give us some feedback. Hopefully you don't feel like we were attacking you. That wasn't the intent. And you might have your own stories to share with us. But please give us your feedback, your comments on our Facebook page at the Deconstructed Woman Community. Please give us your input because we want to make sure that this is value added for all of you. So thanks again. This is Joji and Alyssa Marie signing off for today. Thank you for listening to our podcast, The Deconstructed Woman. If you liked this podcast, please share it with your friends, rate this episode, or subscribe to be notified of all new content. We want to hear from you, our listener. Do you have thoughts on the discussions we're having? Want to share topic suggestions, or want to join us for a topic that you're passionate about? Contact us at our email address, thedeconstructedwoman@gmail.com.